Welcome to Shape of the City, a program on health and wellness topics relevant to the Lincoln community. I'm Clover Frederick and I'm your host. It's time again for open enrollment for the health insurance marketplace. Who should be signing up and when? I have with me today Andrea Haberman with the Lincoln-Lancaster County Health Department and Aaron Bowen with Community Action Partnership of Lancaster and Saunders counties. Thank you so much for joining me today.
Thank you.
Thank you.
Now let's get started with you, Andrea. Tell us a little bit about what the marketplace is. How does it work?
The marketplace is a way people who are uninsured can get health insurance. And you can do that through, there's basically 4 ways you can enroll in a health insurance plan, and that's through the mail. You can get a paper application, through the website at healthcare.gov. You can call in and talk to somebody over the phone about enrollment, or you can get in-person assistance by a place here in Lincoln, Nebraska, which hires people that can help you with that. And we have 4 places in town where you can go and get in-person assistance.
Okay, very good. Now, who should be considering checking out the marketplace?
Yeah, generally people who are uninsured. Most of us have employer-based insurance, about 60% of people. If you have insurance now, you don't need to go on the marketplace. If you have Medicaid, Medicare, veterans insurance, you don't have to go on the marketplace. So it's really just for people who are uninsured.
Okay, very good. Why is the marketplace such an important resource for the community?
That's a great question. It's very important because if you have health insurance, you have a way to pay for health care. And health care can be expensive. In fact, a 3-day stay in the hospital can be about $30,000. To get a broken bone fixed, like a big leg bone, it costs about $7,500. That's very expensive. If you don't have insurance, you have to pay all of that cost out of pocket. If you have health insurance, your health insurance company is negotiated with healthcare providers to get you a lower cost. So if you and I both had the same we were both having the same health service, if I was insured and you weren't, I would be paying about 40% less for that service than you would. So it's a way to get health care at a lower cost.
Okay. Now, what are some of the important dates that people need to keep in mind about the marketplace, because it's not open year-round?
Yes, right, exactly. There's a shorter period of time. It's November the 15th of this year till February 15th of 2015 when it's open enrollment. And during that time period, people who have not had health insurance can get on, and people who were insured last year through the marketplace can go back and shop again for health insurance.
Okay, now if somebody is returning to the marketplace from last year, what should they know?
They should have received a notice from their health insurance company, and that's a very important notice to keep track of. It has a long number on it that you will use when you go back into healthcare.gov to either re-enroll, and you can be automatically re-enrolled. If you like your plan, if it's still offered, you will be automatically re-enrolled. But it's still a good idea to go in and make sure all your information is current, like your income, whether you're employed or not, if you've gotten married, something has changed, you've adopted a child, something like that. So it's very good every year to go back into the marketplace website at healthcare.gov and make sure that all your information is correct. Now, why that's important is because if your income has changed or you're adding family members, your premiums or the cost of buying health care insurance could actually be lower this year than they were last year. So you want to make sure you're getting the best deal. And you also want to make sure that if your needs have changed, you might want to move over to a different health insurance company. So you have the right to do that every year. So people should get into the practice of looking at their health insurance plan and policy every year.
Okay, now we heard some things last year about the marketplace website not really being up to snuff. So
yes,
what's changed since last year?
Well, it's much improved.
Okay.
If you go on the website, which you can right now because the marketplace is open right now, You can tell there's been a lot of improvements. It's a lot more user-friendly. There are tools to use when you put in your income that will tell you about how much you'll pay in premiums per month. There's also very good tools if you are an immigrant that will talk about what documentation that you will need. And they even give examples of what that documentation looks like, because that can be very confusing. So they really have a lot of self-help tools that were not available last year. And just overall, the wording, the context is a lot easier to understand. Health insurance is very confusing. So they've really worked hard on using more understandable terms.
Okay.
So much
Very
improvement.
Good, good. Now, you did say for people who would feel more comfortable talking to somebody in person about their health insurance needs, so there are 4 locations in Lincoln, which we'll put resources up on the screen for those 4 locations. But one of those locations is Community Action Partnership. So Aaron, tell me a little bit about Community Action Partnership and how you are helping with the marketplace.
Well, my agency serves 2 counties, Lancaster and Saunders counties, and so last year when the marketplace first began, with a federal grant that came through Community Action Nebraska, which is the state association for all 9 of the state's organizations, we were able to access federal funding to begin our Navigator program, which basically there are certified application counselors and there are navigators. The primary difference is a navigator does more outreach, but at Community Action this year we're going to have 7 individuals who are trained. 6 of those will be certified application counselors, 1 will be a navigator. 6 of those folks will be available in Lancaster County and then 1 in Saunders County. So for folks in Saunders County, the best thing to do is to call Community Action at 471-4515. You know, I think the main thing we want to stress to people is don't delay. Even though it goes until February 15th, sometimes there are glitches. Sometimes you may have questions on your application. To make sure to call and ask for a health insurance enrollment appointment at Community Action. We'll be able to schedule you a sit down with somebody to go through things. Appointments take generally 45 minutes to an hour and a half, but it's going to depend on your certain situation. And if you just have one question, give us a call. It's great to sit down with someone, or you can call the toll-free number with the marketplace. We're also looking for volunteers to expand the number of people we have available to assist, because there's going to be a lot of people coming in. We want to make sure we get to everybody, because that December 15th deadline for January 1 coverage to begin is looming. And so don't delay, get in as quickly as possible. Also, we're going to have Wednesday evening appointments available, and we'll have available appointments in Spanish. And I hopefully the community, we want them to stay tuned. We may be able to put together a December 13th community event right before that December 15th deadline to make sure that people who have waited till the last moment can get that assistance. But I think overall for Community Action, we serve primarily families who are of low incomes, and health is a huge concern for them, especially the costs that Andrea was talking about are astronomical for families who aren't expecting this, and if they don't have a go-to doctor, they end up utilizing emergency room care for a lot of those things, which we all know is much more expensive than preventing those emergencies or getting care when they need it.
Right. Now, what other resources are available to people who are interested in the marketplace?
Well, number one is to go to the website. We stress to everyone, whether they call or come in, to check it out first. You can call the toll-free number. You can fill out paper applications, but I think the best thing to do is to talk with someone one-on-one. I think last year we learned that people would come in who had paid thousands and thousands of dollars in premiums over the year and never thought they would be able to qualify. And it's important to know that every plan in the marketplace is going to cover essential benefits. There are no pre-existing conditions. And so folks who never thought they would have insurance, or it wasn't possible, or it would cost too much, we've seen so many people come in and it's available to them, and it's at a far lower cost than they ever expected.
Now, a lot of Nebraskans got signed up in the marketplace last year, didn't they?
Yes. Actually, that's very exciting. About 44,000 Nebraskans enrolled in the marketplace in the last open enrollment period. And what's really encouraging about that is 7 out of 10 of those people, nearly 7 out of 10, received help so that they pay no more than $100 per month for their premiums. That's quite a deal. And we know that this year, if you're re-enrolling in the program, that you want to make sure you're very careful in canceling your old coverage and then getting on a new policy. So it's very important to make sure you don't have 2 policies going at the same time. You need to cancel one and then enroll in a new policy.
Okay, very good. And there are some online resources available, correct?
Correct. We've made some videos with a local flavor to them to talk to people about what's available locally for you for help in the marketplace. And those are on Channel 10 Health YouTube.
Okay, very good, very good. Well, thank you both for joining me today. We look forward to all the people you're going to be helping through with the marketplace. Thanks a lot.
Clover.
Thank you.
We'll be sure to list those resources on your screen. And when we return, we'll be talking to some people who are working on a great program to help with children's health in our community. Welcome back. I'm Clover Frederick, your host of Shape of the City. Now, we've heard childhood obesity being referred to as an epidemic. In fact, a recent study at the University of Nebraska-Lincoln found that overweight children ages 2 to 5 years old were 5 times more likely to still be overweight at the age of 12 than their counterparts. Now, a local program called Growing Great Beginnings is combating the problem. And here with me today are Jill Bomberger and Ruth Burke of Community Action Partnership. Hello and welcome.
Morning.
Thank you.
Thanks for coming. Now, Jill, let's start with you. Can you tell us just a little bit about Community Action Partnership's Early Head Start program?
Sure. So Early Head Start and Head Start are comprehensive early childhood programs that we run in Lancaster and Saunders County. We serve 710 children. In our Early Head Start home-based program, we serve 140 children ages 0 to 3 as well as expecting families. These families receive weekly home visits from family educators like Ruth. And really the focus of those visits is to empower parents to support their children's development and really promote their school readiness and success in kindergarten and beyond. One of the things that's unique about Early Head Start and Head Start is that we have a focus on the whole child and family. So not only are we talking about sort of the typical school readiness that people think about, but also children's health, mental health, nutrition, and family services as well.
Okay, very good. Now, tell me about Growing Great Beginnings. It's a relatively new program. Tell me where the idea came from.
Back in about early 2013, we started looking at some of the needs of participants in our program, and we were seeing that relatively few children in our program were eating adequate numbers of fruits and vegetables. They were having lots of sugar-sweetened drinks, or more than is good for them. Also, parents were telling us that I think we had less than 25% of our parents who themselves ate recommended numbers of healthy foods. We also saw some troubling numbers of children who were exiting our Head Start programs going to kindergarten who had high BMIs. The interesting thing that we found at the time was the number one thing parents told us they wanted to learn about was nutrition. So that was perfect. And we started looking at what was out there and how we could help empower parents to be able to provide good choices for their children and establish healthy eating patterns. One of the things we found was that most of the curriculum and materials that were available were for preschool-age children and children who were in childcare settings. And we were seeing children at that age already having concerns that we wanted to work with. So we partnered with local organization Teach a Kid to Fish, who's pretty much the expert in that. And they worked with us to develop a curriculum for use in our home-based program so that our family educators could go in there and work with parents to help teach them not only sort of what the recommendations are, but how do you do that as your child is developing and growing and being sure to establish those healthy eating patterns and feeding behaviors and things like that.
Okay, very good. Now you mentioned BMI, that's body mass index, and
Yes.
it's one of the ways that you can measure. So that kind of leads me to the next question. What
Sure.
are some of the ultimate measurable goals of this program?
So our long-term goal is definitely to prevent obesity and overweight, which is measured by BMI, but it's also in the more short term to establish those healthy behaviors that we know are associated with that. So things like making sure that children are eating adequate numbers of fruits and vegetables, making healthy dairy choices, things like making sure that families are engaged in lots of physical activity and cutting down on screen time, and then definitely cutting back those sugary beverages.
Sure. Now, the program has been going on for a little while now, so have you been able to reach some of those goals?
Yeah, we've had some exciting impacts in our first. We sort of did a pilot project where we tracked a lot of data and wanted to see how well the intervention was working. We saw a 23% increase in the number of children who were eating appropriate numbers of fruits and vegetables, and then a 27% decrease in the percentage of children who were drinking sugary beverages. So we felt excited about that. We also saw increases in physical activity and water consumption, and decreases in screen time.
Okay.
So, yeah.
Are there certain populations in the community that you're working with most?
Sure, we work with a really diverse population, and we serve low-income families in our community. Just about half of the families in our program speak English. We have about 35% who speak Middle Eastern languages and about 15% that speak Spanish. Also in our pilot project, about 17% of those families had been homeless at some point during the year, so just a wide variety of needs.
Okay. What are some of the biggest challenges you're seeing in getting this program out to the community?
Sure. So, some of the things that are most important for families are things that organizations like Teach a Kid to Fish work on, but things like making sure that families are getting consistent messages from their medical providers and childcare providers and schools, as well as just access to food, so people having healthy food options in their neighborhood and then the resources to be able to obtain those. And of course, like with any type of well-being, stressors like domestic violence or housing instability really impact a family's ability to be able to sustain these types of things when they're just trying to make it day to day.
Okay. Well, it sounds like the program's already had some great impact. What's coming in the future for this program?
So we're very excited with the support of the Community Health Endowment of Lincoln. We're going to be revising the curriculum to make sure that it's got the most up-to-date information and really hone in on the things that worked well and change the things that weren't as impactful in the first round. We'll also be translating it into Arabic. We already have it in Spanish and English, but we'll be translating to Arabic. And we'll be doing some expansion of the program as well to make the lessons more appropriate for the ages 3 to 5 as well. And then with support of Community Health Endowment and Partnership for a Healthy Lincoln, we're very excited to be bringing on a nutrition coach who will be able to work one-on-one in depth with some of those families that are at the greatest risk for obesity. Maybe they can go into their homes and work with them on whatever that family's particular need is. So if parents just have never cooked, weren't raised around cooking, really were raised eating unhealthy foods, they can go in and help them just work through it incrementally, or whatever the need is for that particular family. So we're excited to be able to bring that to the families in both our Early Head Start and Head Start programs.
Okay, great. Now, Ruth, let's talk to you a little bit. You're a family educator with Community Action Partnership. So tell us, what are some of the challenges that you face working with families?
In this program, probably some of the biggest challenges was the things that family, making the changes that families would like to change. So when you change the kinds of foods that you eat or the amount of TV that you're watching, how do you substitute different behaviors for those that you're used to? That's hard for families.
Okay. Where have you seen probably the most positive change happening amongst families?
I think in the families, seeing that the amount of sugar, that's one of the things that we had a kit about how much sugar is hidden in soda as well as juice and candy. And it's surprising how much sugar is in there. And so when families see the sugar amounts that are in those food items, they have a greater tendency to change that. And that's been exciting.
Oh, good. Now, do you have a success story you can share with us?
We do, actually. We have one family. She has several children. One of the children, she was about 9 at the time, and her cholesterol at that time even was high. And she made those changes of more fruits and vegetables using olive oil as she was cooking, and she saw her daughter's cholesterol go to a normal level, as well as some weight loss in the family. And she's so excited about it that she wants to share those, be a coach, so to speak, with other families and encourage them to do those healthy things like breastfeeding babies and eating fruits and vegetables and using olive oil. And it's exciting to see that in a family.
That is exciting. Is there anything that we didn't cover here that you want to make sure that the community of Lincoln knows about this program?
I would just you say one of the things that we're really focusing on this is not only teaching parents what the best practice recommendations are, but how do you do that, because it's not easy. I mean, any person who's tried to make a change in their life knows that it's challenged to change habits, but we're really trying to work with families to say, how do you do this as your toddler is throwing tantrums and you're trying to establish healthy meal times, and how do you what are some specific strategies you can implement, and really not only give the information, but teach families how to do this and help children develop those eating habits and patterns and preferences that are going to take them through their whole life. So.
Very good. Well, it sounds like you have a lot of exciting things going on. We look forward to hearing more of those success stories. Thank you both for coming.
Thank you.
Thank you.
Well, now stay tuned. When we come back, we're going to hear about some really great safety tips for when you're out on the bike trail this winter.
Just as a reminder, the health insurance marketplace is open for enrollment November the 15th, 2014 through February 15th of 2015. If you are low income, you may get help purchasing insurance on the marketplace, or you may apply for Nebraska Medicaid at the same time. Thank you.
My name is Damon Hershey. I'm with CycleWorks. I'm here to talk about some tips and tools to make winter riding a little easier. There's kind of 3 things you could break it down to: yourself, as far as like clothing, your bike, the bike itself, and gear and tools that you can add to your bike, and then of course the mindset and skill level for riding in winter. When it comes to yourself and gear or clothing, first thing to remember is the layer. You don't want to have just like a single t-shirt and then a big heavy parka on over that. What you'll do is you want to be able to control your own body temperature. Remember, when you're cycling, you're moving, so you're creating a core heat, body heat. So we want to start with a base layer. So the very first thing you're going to have on is a base layer that's going to wick or pull moisture away from your body. You want to be able to get that moisture away from your body, get it into the other layer so it can start to ventilate away from you. After the base layer, you're going to have your mid layer, and then of course your outer layer. Your outer layer is preferably something that's going to be wind and water resistant, if not waterproof, but you also want to make sure it's still breathable. It helps to even have ventilation points with the bike or the jacket. Your mid layers is something that, depending on your activity, if you're warm-blooded, hot-blooded, the actual temp outside is what you could build up and have multiple layers on underneath. The biggest thing with cycling is overdressing. You don't want to be comfortable warm in the first few minutes of your ride. You actually want to be a little on the cold side, because you're going to be moving. You're going to be building up that heat. If you're overdressed, you're going to sweat more. You sweat more, you're going to get damp, and that's when you can get chilled. And also drink. Remember, you are sweating, you are active, the air is very dry outside. You're going to get thirsty, and your body has a hard time telling you that you are thirsty in cold weather. So make sure to drink before you're thirsty and eat before you're hungry. Moving on to your bike. Now, if you have a bike and you've been riding it in the warm months, you could ride it in the winter. There are certain things you want to check for, though. You want to make sure that your bike is in good operational shape. Winter is hard on bikes. You're riding through sloppy, freezing, wet, cold conditions. There's solvents and salt that's put on the road that's hard on your bike. And the last thing you want to do on a cold commute is to have your bike break down. Things to look out for is your drivetrain. Make sure your chain is properly lubed and cleaned. Make sure it's not worn out. You want to make sure your shifting and brakes are in good operating order. That's something you could take to any bike shop during the winter time. They have plenty of time in most bike shops to focus on your bike. A few tools that you can add to your bike to make it a little easier. just like cars, there's good winter tires that you can do, just from a knobbier, softer rubber compound to full-on studded tires. You want to have fenders, one to keep all that slush and gray snow from splattering up on you, but also keeps your bike cleaner, so it's easier to maintain the drivetrain. Other things like having a rack and waterproof panniers are going to make it easier for transporting yourself and what you need. Lights, you want to make sure you have front and rear lights on your bike. Lights are that much more important in the winter months because it is darker longer, it gets darker sooner. High-vis clothing, outer jackets, gloves, high-vis helmets and helmet covers are also a good idea. Anything that can help you being seen and make sure that people are aware of you being out on the road. There's other things like pogies. They're almost like a big mitten that goes over your handlebar. Nice thing about that is just like with your cord, you could layer underneath them. Mild day, you could just get away with a liner on most pogies, all the way to big, thick wool mittens underneath them. Winter riding is a little bit different than riding most of the year. A lot of it's just mindset. Do what's comfortable for you. Maybe just make Monday and Friday your bike to work day. If it gets too cold or icy out, that's okay. Ride another day. Start out slowly, get comfortable, build your confidence, take your time, realize it might take, especially if the roads conditions are icy or snowy, it's going to take you a little bit longer. Give yourself that extra time by leaving a little earlier maybe. Be aware that your riding style might change a little bit. It's okay to take over a lane. If the conditions are bad, you might have less road to share with, so go ahead and take that lane. You're only going to hold up traffic or be part of traffic for a little bit longer. Riding in winter is really not that big of a deal. If you have the right mindset and you're properly prepared, you're safe, aware of your surroundings, anyone can ride all year round. Remember, it's riding a bike. It's fun.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thank you for watching. Until next time, get active, eat healthy, and stay informed. Check out this and other 10Health TV programs on YouTube. Follow programs and local events on Facebook and Twitter. And don't forget to check out our community calendar at lincoln.ne.gov, keyword 10health.